My name is Steve Wooden. I'm an advanced practice nurse in the specialty of anesthesia. I want to talk to you today about health insurance, the need for health reform, and how it is all tied to the American dream. I see patients every day that are uninsured or underinsured. Most of them have no choice to be insured because of pre-existing conditions, lack of employee-provided health care, or simply because of lack of financial means. The lack of health insurance weighs heavily on them every day and often prevents them from pursuing the American dream.
The American dream is about choice, it's about fairness, it's about being affordable, it's about access.
It's almost like vaccines. The fact that everybody gets vaccinated, it only helps us all.
If we had health care reform, what our patients are going to see is an increase in their quality, affordability, and access of care.
And if you don't have insurance and you need that little purple pill, you go to the drugstore and you pay $160 for 30 of them. Your friend with insurance, on the other hand, will pay a $30 co-payment, and their insurance company will get a $50 or $60 kickback every month. Nowhere else in healthcare are kickbacks legal or considered ethical, but this is one way that the drug companies can artificially keep the prices high for people without insurance. This is absurd.
The financial pressures imposed on these individuals carry a tremendous burden that influences their healthcare decisions. And the decisions they make are often to delay needed health care, to cut corners, or to avoid health care altogether. How can you blame them? The system is set up to be unfair to those who do not have health insurance. The uninsured are charged 3 to 10 times the Medicare rate for most healthcare procedures. An uninsured patient may be charged $3,000 for a CAT scan at a hospital that will collect $450 from Medicare or $650 from a private health insurance company with whom they contract. These same patients seldom seek preventative care and end up in the emergency room where the financial disparity between the insured and the uninsured is even greater.
I would like to tell you my story. I've been uninsured since 1984. Being uninsured is not my choice. I simply cannot get affordable health insurance in the American healthcare system. I feel that if my story can persuade just one policymaker to support health care reform, then it'll be worth my time. When I was 24 years old, I developed testicular cancer. At the time, I was a married, self-employed contractor. In 1980, I changed occupations but was able to maintain my insurance coverage with the exclusion of testicular cancer as a pre-existing condition, requiring me to pay for follow-up CT scans from my first operation out of my own pocket at around $2,000 each. In 1983, insurance coverage became much too expensive and I wasn't able to maintain coverage and run a business. Against the odds, in 1995, I again developed testicular cancer. This time, all the doctor's visits and treatments were completely out of my pocket. The hospital wasn't accommodating, asking for their fee up front and charging over twice the rate charged insurance companies for the same procedure. In order to reduce costs, I had the operation I needed as an outpatient, limiting my stay in the hospital to no more than 24 hours. I recovered at home with the assistance of my family. In addition to the medical expenses, being out of work for several weeks when you are self-employed is a major expense unto itself. 2 years later, in 1997, and shortly after catching up with my medical expenses, while I was helping coach high school kids on their track team, I fractured my left hip. Again, not having insurance delayed me from first seeking treatment for the injury, and later, after being diagnosed with avascular necrosis of my left hip, it prevented me from being able to get the hip replacement I needed. The way it originally played out was that my orthopedic surgeon told me I needed a total hip replacement, so I scheduled the procedure. The hospital told me to come in the day before the operation to sign the necessary paperwork. I met with the hospital bookkeeper the day before the operation. She looked at me straight in the eye and without hesitation told me that everything was in order and I could make my check out to the hospital for the sum of $30,000. I was shocked. She explained that since I was self-pay, I was required to pay the entire amount up front. I asked if I could arrange payment terms, and she chuckled and said that they did not have a policy in effect that would allow that kind of arrangement. I canceled the operation. The hip pain I have is excruciating, and it is necessary for me to use crutches to do my work. I have a hard time competing for larger jobs in my field of work, and instead I have to settle for any work I can get. I don't qualify for public assistance, and I can't take many pain medicines because of a bad kidney, and sometimes I'm awake all night in pain because of an exceptionally hard day on my feet. I don't expect or want anything given to me. I just want a fair, level playing field. My dream is to live without pain. I can only imagine how my life would be different if I had health insurance. Perhaps my American dream would be different. Thank you for listening.
To see the way our system deals with the uninsured is not only tragic, but also painfully personal. That was my brother that just told you his story. I have seen him live in pain for over 20 years because he cannot get insurance, cannot get public assistance, and does not make enough money to afford the hip replacement he so desperately needs. He just wants to be treated fairly and be allowed to pursue the American dream, free of pain, and be allowed reasonable access to our healthcare system. Please support healthcare reform that will give the uninsured access to healthcare at a reasonable cost. It is what many take for granted, but unfortunately, what some have never seen.